Ever wondered how far science has dared to venture into the human brain in the name of progress? Today we're delving into a chapter of medical history that's as fascinating as it is chilling. The story of the lobotomy. In the first half of the 20th century, this procedure was hailed as a revolutionary breakthrough in the treatment of mental illnesses. Doctors, driven by the desire to alleviate suffering, would literally cut into the brains of their patients, removing or damaging parts of the frontal lobes. They believed this could cure conditions like schizophrenia, depression, and anxiety. The lobotomy was an audacious attempt to solve the riddle of the mind, a daring dance on the precipice of the unknown. Its proponents saw it as a beacon of hope, a shining testament to the triumph of human ingenuity. But as we now know, the story doesn't end there. So, how did this once celebrated procedure fall into disrepute? The journey of lobotomy started in the early 20th century, a time when understanding of mental illness was quite limited. A Portuguese neurologist, Egas Moniz, found himself at the forefront of this intriguing yet terrifying journey. Moniz, intrigued by the potential to alleviate the suffering caused by mental disorders, pioneered the prefrontal lobotomy. The procedure involved severing connections in the brain's prefrontal lobe, often resulting in drastic changes in personality and behavior. In an era of limited treatment options, Moniz's method was groundbreaking. It was met with a mix of apprehension and optimism within the medical community. On one hand, it was a bold, uncharted approach that carried significant risks. On the other, it promised a potential solution for mental conditions that were otherwise deemed untreatable. Despite the high risks, lobotomy was seen as a beacon of hope for those suffering from mental disorders. The 1940s and 1950s marked the heyday of lobotomy, but also the beginning of its end. Enter Dr. Walter Freeman, a neurologist with a flair for the dramatic. Freeman, a charismatic and persuasive figure, was instrumental in popularizing the lobotomy in the United States. He toured the country in his infamous lobotomobile, demonstrating his quick and easy ice-pick lobotomy method, often on unwitting patients. His showmanship, combined with a woefully inadequate understanding of mental illness, led to a devastatingly indiscriminate use of the procedure. The lobotomy, while sometimes successful in calming unruly patients, often had catastrophic side effects. Sure, it could leave a patient docile, but it could also leave them in a vegetative state, or worse, cause their death. Patients who survived the procedure often lost their personality, their creativity, their very essence. They became shadows of their former selves, unable to engage with the world in a meaningful way. Yet, despite the mounting evidence of the harm caused by lobotomies, Freeman continued to perform and promote them. While Freeman was busy wielding his ice pick, a growing chorus of voices from the scientific community began to question the validity of the procedure. They pointed to the lack of rigorous scientific research supporting lobotomies and the alarming number of patient deaths and complications. They argued that the procedure was not only ineffective, but also unethical. The advent of antipsychotic drugs in the 1950s marked the beginning of the end for lobotomy. These medications, while not without their own side effects, offered a less invasive and more effective treatment for mental illness. They allowed patients to maintain their personality and dignity, something the lobotomy had so cruelly taken away. As these drugs became more widely available, the demand for lobotomies dwindled. Freeman performed his last lobotomy in 1967, marking the end of an era. The lobotomy had risen quickly, fueled by desperation and ignorance. But it fell just as quickly, brought down by scientific progress and a growing respect for patient rights. The advent of antipsychotic drugs in the 1950s marked the beginning of the end for lobotomy. Lobotomy, even though abandoned, left a lasting impact on psychiatry and medical ethics. The echoes of this ill-fated procedure still reverberate in the halls of medical history, serving as a grim reminder of our past missteps. In the wake of lobotomy's decline, the medical community was left with sobering lessons. The first among them was the importance of informed consent. Patients and their families must be fully aware of the potential risks and benefits of any procedure. In the case of lobotomy, this principle was egregiously overlooked, leading to untold suffering and regret. The second lesson was the necessity of rigorous scientific evaluation. Procedures should be backed by solid empirical evidence, not just anecdotal success stories. The lobotomy era was marked by unchecked enthusiasm and a lack of comprehensive scientific scrutiny, resulting in a widespread acceptance of a deeply flawed procedure. The story of lobotomy serves as a stark reminder of the dangers of unchecked scientific enthusiasm and the importance of ethical considerations in medicine.